Hi there, the purpose of this video is to explain basilar joint arthritis and the treatment options available for this common hand problem. We will also inform you of alternatives to surgery, risks, and potential benefits. I will answer some of the common questions asked about this procedure by patients who I have talked to about this over the years. There is additional information available about this and other hand and arm conditions we treat at our website at floridahandcenter.com. Basilar joint arthritis refers to arthritis that affects the joint that connects your thumb to your wrist. This joint is very important and is involved in nearly everything you do with your hand. It is an extremely mobile joint with high amounts of strain when you pinch or hold things. It is the most common joint in the hand to be disabled by arthritis. The condition is more common in women, especially from ages 50 and above. We do see it, however, in men as well as younger individuals. Patients with basilar joint arthritis will have difficulty with activities like turning keys or opening jars. We are able to treat most patients with basilar joint arthritis with cortisone injections and splinting. I am certain that we have tried that with you. The mere presence of arthritis does not require treatment, as many people will clearly have this problem but are not experiencing significant pain. Surgery is offered when we cannot control the pain. The surgery for basilar joint arthritis is called a basilar joint arthroplasty. It is an outpatient procedure done in an ambulatory surgery center or a hospital outpatient surgery department. We prefer to use a regional type of anesthesia or nerve block where your arm is given a numbing injection and combined with intravenous sedation. It is not usually necessary to have a general anesthetic. This type of anesthesia is safe and very effective, offering significant advantages to the patient, including no general anesthesia side effects like nausea and long-lasting pain relief, where the patient will be comfortable for their trip home. After the arm is numb, the procedure is done with 2 small incisions in the wrist and forearm. It lasts about 30 minutes. The arthritic joint is taken apart, removing a small bone in the wrist called the trapezium. A tendon from your arm is then used to suspend the thumb or flexibly connect the bottom of the thumb to the bottom of the index finger. This allows a scar tissue joint to form where the arthritic joint used to be. Although the procedure may sound complicated, it is not and has been in existence for nearly 40 years. It is among the most time-tested and successful procedures in the hand. Most patients will experience some degree of pain after this surgery, but we treat this pain very aggressively. Through the use of cold therapy, strong oral pain medication, and regional anesthesia, we are generally successful in controlling the pain. The pain will usually subside after a couple of days, and the arthritic pain disappears immediately after the surgery and never returns. You will be in a bulky bandage until your return to the office about a week after the surgery. At the first office visit after surgery, the bandages and stitches are removed and your hand is placed in a cast. This cast protects the thumb but allows light use of the fingers and arm. It remains in place for 3 additional weeks. About a month after your surgery, you return to the office and meet with our occupational therapist, or with an occupational therapist in your area if you are one of our many out-of-town patients. Your cast will be removed and you will begin hand therapy. Therapy for this procedure consists of treatments to reduce stiffness, swelling, and whatever residual surgical pain remains in the thumb. It will typically last for 2 to 6 weeks depending on your progress. By this time, your pain should be minimal and continues to get better over the recovery period. Flexibility recovers quickly, and along with that, the use of the thumb and hand. Strength recovery can take a while. Many patients will see that slowly improve over the weeks and months after surgery. To the best of our knowledge, all of the patients that have had this procedure have returned to nearly all of their normal activities and have been satisfied with the result. The results also appear to be durable, unlike a joint replacement that may wear out. Like any medical procedures, there are no guarantees and there are some risks. These risks include infection, tendon, artery, or nerve damage, and poor healing. Fortunately, these risks are very uncommon, with more than 95% of patients very satisfied with the procedure.